Welcome to HITshow, your go-to source for today's leading healthcare business headlines. I'm your host, Ida Klein. It's Thursday, September 18th. Today on HITshow, providers lean into AI and virtual care to give time back to the bedside, while big systems sharpen their finances. We'll start with Ardent Health moving from pilot to an enterprise rollout of ambient AI across its medical groups, then Ascension's improved fiscal 2025 performance and what drove it. After the break, Garmin teams with King's College London on a large-scale maternal health research program. University Hospitals lights up a whole hospital virtual nursing model with Vitalchat, and we close with an in-depth look at virtual nursing's workforce impact, featuring VirtuAlly's Chief Nursing Officer, Angel Bozard. Let's get started. Ardent Health is moving from pilot to enterprise rollout of Ambience Healthcare's Ambient AI, aiming to finish implementation across all of its medical practice groups by March 31, 2026. Jade, what's the scoop?
Ardent, which runs 30 hospitals and approximately 280 sites of care across 6 states, piloted Ambience in ambulatory clinics spanning 17 specialties and 7 languages, and says the results were decisive. 70% of pilot clinicians reported lower cognitive load, 100% said job satisfaction improved, and documentation time fell 45%, saving about 5 hours per clinician per week. The pilot logged more than 140,000 encounters with nearly 90% encounter utilization. I spoke with CMIO, Dr. Brad Hoyt, about Ardent's why.
Yeah, at Ardent Health, we are super interested in improving the daily lives of our providers. We want to use technology to keep the providers we have working longer and to be able to recruit to our markets.
Ardent evaluated multiple ambient tools in the pilot before selecting Ambience for the system-wide deployment. The platform goes beyond transcription to generate specialty-aware notes and point-of-care coding inside the Epic workflow. On adoption during the pilot, Dr. Hoyt said.
At Ardent, we had 90%, so our providers were using it almost all the time.
Ardent also tracks hard metrics, not just sentiment. During the pilot, documentation time decreased 45%, and clinicians reported spending more time with patients, less time in the EHR. Dr. Hoyt, on those measurements.
We had a 45% drop in measured and charting time by our providers. We actually measured it via our Epic signal metrics, and it was a 45% decrease, cutting down by 45%, which is an hour a day, is a huge provider satisfier for us.
Jade, what's the rollout plan from here? And where could this go next?
Ardent targets full ambulatory deployment by end of Q1 2026. Longer term, they plan to extend Ambience to nurses, emergency departments, and inpatient units, taking ambient AI beyond the clinic into hospital workflows.
That's definitely a big swing on burnout and bedside time, and one to watch as the rollout scales. Turning to finances, Ascension just posted a markedly smaller operating loss for fiscal year 2025. Logan?
Ascension reports a $490.9 million operating loss for fiscal year 2025, an operating margin of minus 1.6%. That's a $1.3 billion improvement from fiscal year 2024's $1.8 billion loss and a negative 6.3% margin. Net income landed at $918 million for the year. Drivers per the system included stronger patient volumes, improved labor productivity, and tighter control of non-labor costs. On the top line, total revenue was $25.3 billion, down 11.3% year over year due to portfolio changes. On a same-facility basis, total operating revenue rose 6.6%. Operating expenses fell 14.1% overall, down 1.5% for salaries and benefits on a same-facility basis, as labor efficiency efforts reduced turnover.
So, Logan, what should hospital leaders read into this turnaround?
I see 2 takeaways. First, the labor story. Less premium staffing and better retention mattered to the margin. And second, portfolio mix clouds year-over-year comparisons, so the same facility growth and expense discipline are the cleaner indicators to watch next quarter.
After the break, Garmin teams with King's College London on a massive maternal health dataset. University Hospital scales virtual nursing across a whole hospital with Vitalchat. And we close with an in-depth look at the workforce impact, featuring VirtuAlly CNO Angel Bozard. Stick with us.
HITshow is made possible by Altera Digital Health's Sunrise EHR, the flexible solution that provides tools and technology clinicians need to deliver better care their way. And with AI integration, Altera is leading with heart, bringing the human side of healthcare even closer.
Welcome back. You're listening to HITshow. Now to New York's Garmin Health Summit. Garmin is teaming with King's College London on a global maternal health program called Embrace. Nate Collier has the details.
Garmin is the exclusive smartwatch provider for Embrace, which plans to collect data from up to 40,000 adult participants, pregnant women and their partners, worldwide. Devices will capture heart rate, HRV, sleep activity, energy expenditure, body battery, and beat-to-beat intervals to train AI models that target gestational diabetes, pregnancy hypertension, and perinatal depression. The effort is backed by Inkfish Philanthropy and was unveiled at the New York Stock Exchange during the summit. I spoke with Scott Burgett, Senior Director of Garmin Health Engineering, and I asked about the summit's role.
So the Garmin Health Summit is an annual event that Garmin Health puts on where we bring together people from all over the digital health industry, and it's really a great event with great energy.
So, for Embrace, why is Garmin such an important part of this research?
Okay, we're super excited about the Embrace program and our collaboration with King's College. So we know that it's important for mom and baby to get off to a good start. You don't need access to a clinic necessarily to be able to wear a wearable, right? It kind of brings that healthcare setting closer to where the pregnant person is, right?
Thanks for joining us, Scott.
Thanks, Nate. Thanks for having me on the show. I really enjoyed speaking with you today.
Nate, what makes this dataset stand out?
Two things: scale and specificity. Tens of thousands of consented, continuous biometrics tied to maternal outcomes, and device consistency, since Garmin is the exclusive provider across the cohort, which reduces hardware variability in the signal.
University hospitals just flipped the switch on a whole hospital virtual nursing model built on Vitalchat to put more bedside time back where it belongs. Anika has the details.
University Hospital says the UH Lake West Go Live makes it among the first US systems with virtual nursing available across every inpatient unit. The Connected Care team runs on Vitalchat's AI-driven audio and video platform and supports bedside teams with admissions, discharges, patient education, continuous monitoring, and urgent interventions, so on-floor nurses can focus on hands-on care. This builds on Phase 1, which spans 6 units across 5 hospitals from a centralized command center with 1 remote nurse per unit. Early outcomes included higher patient experience and caregiver engagement scores, plus more efficient support for key workflows like falls prevention, and participation in 3 clinical studies, including an FDA-supported fall risk AI trial. What's next? UH plans to pilot 24/7 operations, add virtual patient observation, and extend use cases into the ED and OR, scaling the model beyond med-surg into higher acuity environments.
So, Anika, operationally, what should health system leaders be watching if they're also implementing a virtual nursing trial?
Start with the staffing design and role clarity. UH proved you can run this from a central command with defined website versus bedside ownership. Pair that with change management on the units, then track what matters: time return to the bedside and the patient-clinician experience as you expand toward 24/7 coverage.
Great context. And next, Jalen zooms out with an in-depth look at virtual nursing's workforce impact, featuring VirtuAlly CNO Angel Bozard.
Thanks, Ida. Everywhere we look, leaders point to the same root issue: workforce. 2 quick voices we spoke with frame it. First, I asked Regina Foley, Chief Nursing Officer at Hackensack Meridian, what is the number one challenge facing health systems today?
Certainly, one of the biggest challenges Hackensack Meridian is facing, as well as all healthcare is nationally, and I would even say globally, is workforce.
I asked Noreen Bernard, Chief Nursing Officer at UC Health in Colorado, the same question.
Yeah, I think, patients are coming in more complex than they've ever come in to us before, and they change quickly. So I think the biggest challenges right now are workforce. And all of the things that go with that.
That's the why. A proven how that we're seeing scale, just like UH is doing with Vitalchat, is virtual nursing, offloading admin work so bedside time goes back to patients. Here's Angel Bozard, Chief Nursing Officer at VirtuAlly.
A lot of time and effort spent in the chart and not with the patient providing meaningful care. So our goal at VirtuAlly is to reduce that administrative burden for the staff, and that allows them to spend that time face-to-face, hand-to-hand with the patients.
The purpose is simple: make hospitals healthier places to work and keep bedside nurses at the bedside.
I would say VirtuAlly is committed to making our healthcare systems a healthier place to work. And our desire is to keep bedside nurses at the bedside. And our virtual care model helps do that.
And it can move the retention needle.
One of the hospitals we've been in the longest, we've actually seen a 65% reduction in their turnover rate. It's a rural hospital in South Carolina. It's really difficult to staff at that hospital. It's really hard to keep nurses at the hospital, but we've been able to do that. And they use us as a recruitment tool now.
And so, Angel, what's the bigger picture?
Like we said before, our healthcare is in crisis. Our staffing is in crisis. And we know this works. We've heard this from so many bedside nurses and so many bedside leaders that we know that this is a model that is sustainable for the future and the evolution of healthcare.
What's one starter move for hospitals considering a virtual nursing program?
Start with roles and standard work. Define webside versus bedside ownership. Tighten the admission/discharge handoff, and track two numbers: nurse time with patients and turnover trend. That keeps you out of pilot purgatory.
Clear steps and encouraging results. Thanks, Jalen, and thanks to Angel Bozard for joining us. That's all the time we have for today. Thank you for joining us on HITshow. If you liked these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. HITshow is made possible by Kimchi. Transform your team with an agentic AI workforce that creates, optimizes, and distributes marketing content while keeping the human touch. For an AI workforce powered by you. Kimchi.com.